you very much. I'm also going to link in with the last talk in terms of bringing your practice into education as well. The original title here was Learning Through Objects, and linking to Simon's talk, I've distributed a few objects here and something you might think about in your own education and learning as well. And so, this is Johnny. He's a 6-year-old boy who presents with abdominal pain and vomiting. And first of all, his mum gives him the typical Irish cure for this, which is flat 7-Up. This is kind of Irish disordered head. And what she doesn't know, and we don't tell her this, how much sodium in 7-Up? Practically none. If she were to give him oral rehydration therapy, how much sodium would he get with oral rehydration therapy?
60 mil.
60. I think you told me this morning you give lots and lots of oral rehydration therapy where you work, and this is the first time you've read the label on oral rehydration therapy. And the one you got there is 60. The one you get in Africa will have 90 millimoles because it loses more sodium in developing world. Just a lesson in that we don't often read labels. So he goes into hospital, diagnosed with an appendicitis. What happens in Irish hospitals? The operation gets delayed. So he remains on IV fluids for 24 hours. He continues on a bit of vomiting. He might even have a diarrhea, loose stools. Eventually he gets operated on. His appendix won't look like this. It's probably close to perforation. He's been quite sick. He comes out. He's still vomiting after surgery. He doesn't feed. He stays on his IV fluid, and at 48 hours he has a seizure. As paramedic, you're going to be thinking, first of all, airway, breathing, circulation, and don't ever forget the glucose, and you check your blood sugar is normal. It's not hypoglycemia. The electrolytes come back. First of all, he's on IV fluids. One of the other things when we look at IV fluids, we see 5%. Does anyone know what 5% means? Certainly not a lot of the doctors I talk to have forgotten the physiology. 5%, 5 grams in 100 mils, 10%, 10 grams in 100 mils, 0.9% saline, 0.9 grams of sodium chloride in 100 mils. Is this a good fluid for children? Not a good one. There are no electrolytes in it to keep your blood sugar up, but there won't be any electrolytes in it. So we can't use that as a maintenance in children. And it has been used, and it leads to the problems I will tell you in a moment. That leads to the death of this boy. The cause of his seizure is hyponatremia. And there's two possibilities: either he's lost a lot of sodium, or his sodium has been diluted down. Well, he hasn't had much vomiting. He's had some. He'll have lost some sodium. He's not on diuretics. He's had gastric tubing, but he hasn't been actively sucking out the fluid. He's had a little bit of diarrhea, and he hasn't sweated a lot. He's had a bit of temperature. So I don't think there's a lot of sodium, but I think he's had a real stimulation to his brain releasing antidiuretic hormone. Antidiuretic, anti-P, so he's holding on to water and he's diluting his sodium rapidly because of the stress of the appendicitis. And he's had symptoms of lethargy, headache, confusion, apprehension, and the people around him have put that down to his appendicitis. He's been quite sick. It has failed to recognize that something new has been happening until he got a seizure. And it's too late. So let's look at some of the fluids that children might have got and see have they got a relationship to what happened to him. How much sodium in normal saline? Who's got a normal saline? 154. I'm going to round that off to 150, as we talk about. Can it be used in children? Can. Too much sodium and no dextrose. Children never get maintenance foods without dextrose, or they go hypoglycemia. So, solution 18, we call it, 0.18 with dextrose. How much sodium in that? Who's got? 30 millimoles. So, when I looked at this, first of all, I think it was in Canada. I was well into my training when I said I heard about 1/5 normal saline. That's what it was called. And I recognized if you divide 0.9, that's normal saline, by 5, you get 0.18. Oh, so that's why they call it 1/5 normal saline. So 150 divided by 5, that's normal saline divided by 5, gives me 30 millimoles in 1/5 normal saline. And if I divided into 100, I get 3 millimoles per 100. And that trick, because that's the normal requirements of children in sodium per day, 30 millimoles per 100 mils. And that clicked. Is it a suitable maintenance for children? It is. It's the pediatrician's favorite maintenance for children. But it just gives a basic amount of sodium. And if you have vomiting or diarrhea, you do not have enough. We've used this for years, until the thing that I tell you happened to this boy changed our mind. This was our basic maintenance fluid for children. What about solution 45? I don't know what we call it 45, and we call it sometimes half normal saline, because how much sodium in 0.45 saline? 75 millimoles per litre. Because if you divide 0.9 by 2, half, you get 0.45. So divide 150 by 2, you get 75 in a litre. And that means 7.5 in 100 mils. That's twice the maintenance for children. It's okay to get that because they manage the extra sodium with their kidney. They usually have healthy kidneys. So, is that a suitable maintenance for children? Yes, it is. And if they have extra losses, they'll be catered for in that. So, because of the condition that I'm describing here, most pediatricians have moved to 0.45 as maintenance for children who come in for surgery. Because in 2013, this man here, Bissinger, had described childhood deaths from hospital-acquired water intoxication. It was described well before that. Every children's hospital in this world have lost healthy children to this condition. How has it happened? It's the same story as we saw here. Healthy children, delayed surgery, low concentration of intravenous fluids, vomiting, and then the electrolytes were not checked. They get hypernatremia. They don't recognize it's happening. 50 cases recognized in 10 years. Half of the children either die, or half of them are left with brain damage because of brain swelling. And children are particularly vulnerable to a release of ADH and brain swelling, and it's harder to recognize when they're going into an encephalopathy or brain swelling. So how do we prevent these deaths? Avoid solution 18. It's too low. Give them solution 44.5. This is the most important lesson I want you to take away from today. A child on intravenous fluids should get their electrolytes checked every day. That's the golden rule. Another golden rule is avoid surgical delays in children. That's very important, not just from pain and discomfort, but also from the danger that they can run into. Also, get your doctors and your students to read the labels and bring them the fluids that they're working with, and know your fluids as well. Thank you very much.
That's great.